right, so I already introduced myself to my patient, identified my patient, checked the provider's order, and explained what we're going to do today to my patient. Okay, so my first thing is to remove my old bandage, and I'm going to put an alcohol prep pad and loosen the bandages on the outside so it doesn't damage his skin. I'm going to put that there and explain that he has 25% of this 5x8 bandage covered in sanguinous exudate. This is what we expect to see post-op. This is normal and this is healthy. And then we are looking at a primary wound. Since we intended to do this, this is an incision. So I'm going to discard of everything and my gloves. So I'm going to pretend throw that away. I would dispose of that in the correct biohazard bag since it has discharge on it. Hand hygiene before I apply my new pair of gloves. My hands are already sweaty enough, so you get the gist of it. Okay, now I'm going to measure his wound. Since this is an incision, we do not have any depth, we just have length and width. And I'm going to take the end of my, I guess I could take my measuring device, if it is sanitary to do so, which we are going to hope that it is in this case. We have about 8 centimeters in length, and we have about 1 centimeter in width for redness. Sutures are in place, which is what we want to see. Okay, so since I came into contact with his wound, I'm going to change my gloves one more time before I apply my new bandage. I'm going to perform hand hygiene with the sanitizer present. So I'm performing it. I'm applying a new pair of gloves since I'm going to be coming into contact with his wound. Right? Okay, and now I'm going to clean it. I'm going to spray my gauze pad with my saline solution. I'm going to take some on a new little swab and run it along the line because there's sutures in place. And then I'm going to gently go about the edges and clean this entire area to ensure that it's clean. We don't want any bad bacteria. Dispose of this correctly. And now I'm going to let that air dry for a minute. And then I'm going to get my new bandage. I have my tape already. Okay. All right. And we are going to apply this. Along the edges, we're going to make a little window effect. Make sure my tape is secure. It's a little long, so I'm going to take some of that off. All right, and then we're going to assess if he has any pain or any other questions, and that is all.